Hello students, welcome to this tutorial on antihypertensive medication. So basically in today's session we are going to cover this topic and clinical pharmacology. So now we should first understand what are antihypertensive medication. So basically the antihypertensive medication, these are medication that controls the blood pressure. Okay, so now antihypertensive medication specifically is there to treat what we call high blood pressure. So now first of all, we should be able to understand what blood pressure is before we can even go to the problem with blood pressure. So under normal circumstances, blood pressure at its optimum, everything operates very well in the body. You can't even trace the signs or symptoms that pertaining to blood pressure. So everyone has the pressure at what blood lands in the body, specifically in the blood vessels. But now, what do we mean when we say hypertension? Hypertension, we mean to say there is an alteration, specifically an increase in the blood pressure. The way the blood vessels are pumping blood is higher. That leads to symptoms now. Okay, so now here is the key. When we're talking about hypertension, or rather, yes, hypertension, first of all, like I've said, we need to understand first what is blood pressure. When you look at this blood vessel here, and it is having blood in it, and then when you look at the second blood vessel, which is health one, you are going to see the difference here. Right now, I want us to understand what determines the blood pressure of or what determines low blood pressure and what determines high blood pressure before we can even start talking about medication that solves high blood pressure. So before that, let's try first to look at the definition of blood pressure and the two major factors that determine blood pressure. So here we go. So the hypertension is the most common cardiovascular disease. Okay, so this is telling us that hypertension is actually a cardiovascular disease. It has something to do with the heart and its blood vessels. Yeah, it is defined as a sustained blood pressure of above 140 systolic and 90 diastolic millimeters of mercury. So this is what we mean to say when someone is hypertensive. We mean to say they have sustained the blood pressure of 140 systolic value and then 90 systolic value of millimeters of mercury. So now we are going to review what is the normal blood pressure, and we're also going to look at the categories of blood pressure. At what level is a crisis? At what level we call it normal? Just like that. So now let's look at it. This hypertension is associated with an increase in the peripheral resistance. What is the peripheral resistance? We are going to understand. Peripheral resistance, we just look at the resistance of walls of the blood vessel to the flow of blood. That's what we call peripheral resistance. It's going to be explained very well as we go on. So now let's look at the blood pressure. On the blood pressure, we are going to look at two major important figures. We have what we call cardiac output and peripheral vascular resistance. For us to understand the disorders of the cardiovascular system, specifically this hypertension, we first must be able to understand what blood pressure is all about. So we are saying blood pressure is calculated using the cardiac output. We are looking at the amount of blood the heart pumps out of the heart per minute. Okay, multiplying it with the pulmonary vascular resistance. Where is pulmonary vascular resistance? Once this amount of blood has been pumped out of the heart, it is taken to the rest of the body using a blood vessel. Now this blood vessel what determines pulmonary vascular resistance is how is this blood vessel constricted? Is this blood vessel dilated? Because that affects the blood pressure. So now we are going to look at how exactly that affects the blood pressure. So now, for now, just know that we have cardiac output and pulmonary vascular resistance. Now, let's understand this principle. We are going to start with the first principle, then we are going to the second principle of the entire hypertension. Let's go to the first principle. The first principle that we have here is that the blood vessels are just like water hose pipes. Okay? It is affected by a hose pipe. The blood pressure, like the pressure of water, is going to be affected by a hose pipe and the tap. Okay? So if this particular blood pressure is going, the pressure of water is going to be affected by a hose pipe, the first principle, and it can also be affected by the tap, which is going to be our second principle. First, let's try to understand the first principle. The first principle I'm mentioning is that the pressure of water is to some extent determined by the size of this particular hose pipe. Okay, as you can see here, if this particular hose pipe is having a smaller diameter, as you can see here, if it is constricted, then what happens? If it is constricted, even the pressure of water is going to increase. Now look in this scenario. If this pipe is dilated, meaning it is having a wider lumen, what is happening? What is happening is that even water is going to flow, the pressure is going to reduce. Okay, so I want to mention what is explaining what the first principle is explaining. The first principle is explaining what we discussed to say that blood pressure is affected by cardiac output and the pulmonary vascular resistance. Pulmonary vascular resistance is what we are from explaining. The vascular resistance is about it's about the force that the walls of the blood is exerting on what is exerting on the on blood. And this is what basically we mean when we say pulmonary vascular resistance. The pressure that the walls of the blood vessel are exerting on this blood. And how does the pulmonary vascular resistance affect blood pressure? If the resistance is too strong, in case of a blood vessel is constricted, the pressure is going to be high because the diameter has been reduced. If the resistance is not strong, then blood vessels are more like relaxed, so even the flow of water is not going to be resisted. Okay, so that is the first principle, pulmonary vascular resistance. Now let's understand the second principle. The second principle that we want to understand is about the cardiac output. Okay, what affects the cardiac output? The cardiac output is affected by a number of things. Okay, however, amongst those things is about how strong the muscles of the heart contracts. Okay, how strong the muscles of the heart contracts. So this tap is more like the heart of a human being. If this pump, in case of some conditions, if the heart is not pumping blood or it's pumping nothing or little, then basically we are saying that the cardiac output has been reduced. But look at this heart has been opened and it is pumping enough blood. Then the cardiac output has been increased. This was just for demonstration purposes. At no point should your heart stop completely pumping blood. Okay, but I'm just trying to demonstrate to you that the heart is more like a tap. It's primarily determined by whether this tap is open or not. If the heart is working normally, the cardiac output increases. If there are some condition that is restricting the heart, there could be no pumping of blood or little. So this is the second principle. This is going to say cardiac output. How much the heart is producing per minute also affects the blood pressure. I hope we are moving together. So now, after you understanding the principle, after you've understood the principle to say that blood pressure is affected by cardiac output and the pulmonary vascular resistance, this is where now I need to build the foundation for you to understand how we are going to control this particular hypertension, sustained blood pressure of above systolic value of 140 and diastolic value of 90 millimeters of mercury. Now, from here, since you understand, let's look at the etiology of hypertension. What really causes hypertension? So, hypertension can be classified into two. The first one we're going to say primary hypertension. This was also known as essential, and it is the most common one. It affects about 90% of people. This particular hypertension has no specific cause. It is just associated with the risk factors. For example, family history, okay? Environmental factors like stress, because the body is trying to prepare itself to combat this danger. So the sympathetic nervous system is going to be activated in case of stress so that it can deal with what has been prevented on the environment. Obesity, high sodium diet. You know that water has the tendency to follow the direction of sodium, okay? Then smoking as well. So all these things, these risk factors, their major mechanism of action is that they alter the way the body regulates its blood pressure. So if it is not well regulated, then what happens? What happens is that the blood pressure is not going to be controlled. So this one is a primary or essential hypertension. The most prevalence, 90% of all time, this is what people are actually having, and it's started with some risk factors. Primary. Okay. Then let's go to the second cause, second classification. We have secondary hypertension. Why is it called secondary hypertension? This secondary hypertension is associated with it comes with an associated condition. Okay, so it comes because someone has been made available, or they are what they have, the body has been rendered weak, and hence bringing about failure to control its hypertension. In what cases are you going to see such kind of hypertension? You are going to see it in endocrine disorders. For example, hyperthyroidism, the Cushing syndrome, hyperaldosteronism, coarctation of the aorta, and sometimes, most of the time actually, in pregnancy. There is what we call pregnancy-induced hypertension, meaning this hypertension is due to a secondary condition. So these are the two major classifications of hypertension. So now, let's try to categorize blood pressures. Okay, it's very, very much important that you understand a certain danger with hypertension. Okay, you should be able to know statistically to say, when I measure this particular blood pressure, this particular blood pressure means the person is normal. This particular blood pressure means someone is in a crisis. This particular blood pressure means someone is just moderate. It's very much important. So now, you know that when you're looking at blood pressure, we measure both the systolic as well as the diastolic values. The systolic should always be higher than the diastolic values. If you want to understand more about this one, just actually watch one of my tutorials on the cardiovascular blood pressure, specifically Tutor Oscar. You're going to find it well explained on blood pressure. Okay, or if that's not the case, then you can actually go in the description box and find an associated textbook written by Tutor Oscar concerning blood pressure, and you are going to understand. So now, with the blood pressure categories, when we say someone is having a normal blood pressure, that is around when the systolic is 120 and below, okay, or 80 and below the diastolic. So with this we mean to say when the normal blood pressure is about 120 over 80, this is the normal blood pressure. Then if the blood pressure has elevated to some extent, we call it elevated blood pressure when it is around 120 to 129 systolic and below 80. Systolic elevated, diastolic lowered. Okay? Then hypertension stage 1. There is hypertension stage 1. How do you know that someone is in hypertension stage 1? Is when their blood pressure is measuring in between, their systolic is measuring in between 130 to 139. Then the diastolic is measuring in between 80 to 89. Just know that someone is in hypertensive stage 1. Then there is hypertensive stage 2, when the systolic is measuring about 140 or higher. Then the systolic, that one, then the diastolic is about 90 or higher. Then we describe someone to be in hypertensive crisis. This is too much and it can lead to medical emergency. Okay, the problem with hypertension is that it leads to organ failure. Okay, it's more like you're just giving too much pressure on the heart, you are giving too much pressure on the blood vessels, so it can lead, someone can die within a few seconds. So now, an hypertensive crisis is above 180 systolic and then above 120 diastolic. Then this particular person, we call them, they are in a crisis and they need particular medical emergency. Okay, so now I am going to introduce you to classification of antihypertensive drugs, specifically explaining their mechanism of action and some examples of drugs on that particular class. Okay, and some side effect, and these side effects, you should know how exactly are these side effects caused. So I'm going to give you the method on how we are going to go about this. So under antihypertensive, we have what we call, you can write them down, but we're not going to discuss everything today. We're only going to discuss one category of medication. We have diuretics, we have sympathomimetics, then we have under sympathomimetics we have 3 categories: central acting, beta adrenergic blockers, alpha adrenergic blockers. Actually not sympathomimetics, it's sympatholytics. Yeah, and then we have alpha adrenergic blockers under them. Then we also have adrenergic neural blockers. Apart from that, we have also angiotensin converting enzyme inhibitors. We also have angiotensin 2 receptor blockers. Then we also have calcium channel blockers. Then we also have some vasodilators which act on the arterial, like hydralazine, minoxidil, phenolphotodiazepam. So these, and then we also have some vasodilators which are mixed. When you say mixed, they act on both veins, the arterial as well as veins. So these we have sodium nitroprusside. So this particular medication are actually you need to know them. You need to know them under each class. I was mentioning them because we just wanted you to have a glimpse. So we are going to discuss all these categories of medication. However, this tutorial is just meant for the introduction and talk a little bit about one class of medication, then we go on like that. So now let's go into understanding, since we know those particular medications. So all those therapies that I've given you, their aim of the therapy, what do we really target when you are trying to administer this particular medication? That's what we mean to say antihypertensive aims of antihypertensive therapy. What do we really want to do in this particular regard? So we understand as health practitioners to say chronic hypertension can lead to organ damage. Remember what I told you? Okay, they can lead to congestive heart failure, myocardial infarction, renal damage, and cerebrovascular accident. Okay, with cerebrovascular accident, the other name for cerebrovascular accident is stroke. So now, the aim of therapy is to prevent target organ damage by keeping the blood pressure below 140 and 90 millimeters of mercury. Okay, otherwise above this particular blood pressure, above this blood pressure I've given here, then they are going to lead to organ failure. You know, it's about the organization of the way an organism is made. They are made from fat. So if an organ is not working, we mean to say, if the tissue is not working, so if the tissue is not working, then most likely it also affects an organism. They move from cells, organ, tissue, organ, just like that. So if those particular things are not working well, all these things make up an organism. An organism cannot exist without this organization of cells. So that's how. So if we have organ damage, then most likely we are talking about even the death of this particular person is near. Because imagine you have congestive heart failure, okay? Who is going to be affected? It's a human being. It's an organism, basically. So we want to prevent and we want to keep the blood pressure as normal as we can to prevent organ damage. So now, let's look at the mode of treatment for antihypertensive agents. What do we really focus on when we are treating this particular medication? Because it's a science. This is not social science, you understand? It's not religious education. It's not something that has to do with herbs or anything. We have full understanding of our body system and how we can manipulate it to treat hypertension. Okay, so now, with mode of treatment for hypertensive agents, antihypertensive drugs reduce BP by decreasing. What do we decrease? Okay, we decrease the cardiac output. Because if we decrease the cardiac output, then the systemic vascular resistance is going to be lowered as well. Why? Because if blood is few, the walls of the blood vessel can accommodate this particular blood. So there's not going to be a lot of pressure. It's more like we're using a small pipe of a small hose pipe, and then you just reduce. It's more like you reduce on the tap. You understand? By decreasing the cardiac output, we mean to say reducing the volume from the tap, reducing the flow of water. It's going to reduce the flow of water. You've controlled the hypertension. Okay, so you should reference to the first and second principles I gave you. Cardiac output is more like reducing the tap. Okay, then peripheral resistance. You are going to decrease peripheral resistance. How? You're going to decrease peripheral resistance. There are some medication that specifically dilate the blood vessel. So if a blood vessel is dilated, we mean to say now it is enough to accommodate that particular medication. So in peripheral resistance, we can dilate the size of the hose pipe so that a lot of water is can be accommodated. The blood volume in males is approximately about 5 to 6 liters. In females, approximately about 4 to 5 liters. And how much blood volume you have determines on the cardiac output. How much you have is what is going to be released. So we also want to decrease blood volume. We have some medication like diuretics. Okay, we have furosemide. That particular medication, what does it do? It makes sure that a human being excretes a lot of sodium, okay, sparing the potassium, and then due to that, it's also going to cause someone to urinate more so that they reduce on blood volume. Then what we also do, we are decreasing the sympathetic activity. We all know that sympathetic nervous system leads to high blood pressure. Because why high blood pressure? The body needs a lot of blood, and the body needs the levels of blood delivery to those particular areas is because we want a lot of oxygen. You understand? We need a lot of oxygen, and if we need a lot of oxygen, even blood delivery should increase. That's why there's an increased blood pressure in sympathetic activity, so that we can meet those metabolic activities. So what we can do is we can give someone the medication that we call sympatholytics. Those they more like deactivate the sympathetic tone, so that the body is no longer operating under the sympathetic tone. When we say sympathetic tone, we mean to say even at rest, the sympathetic tone still exists. It operates at its least activity. It only increases when a situation comes, for example, stress. That's why it's associated with hypertension, because when stress comes, even blood pressure need to increase, just like that. So we are going to reduce the sympathetic activity by giving some medication that are actually what? That we can call sympatholytics or anti-sympathetic or antiadrenergic. Okay. Then we also going to decrease renin-angiotensin-aldosterone system activity. The renin-angiotensin-aldosterone system activity is about causing the vasoconstriction of blood vessel. This causes the vasoconstriction of the blood vessel. Vasoconstriction leads to high blood pressure. So we are going to give some medication like angiotensin converting enzyme inhibitor, so that we inhibit this particular activity. Once it is inhibited, then a human being, the blood pressure is going to be decreased. So this is the mode of treatment for some of our antihypertensive agents, as we are going to continue discussing. Okay. So now let's look at one classification in detail. This classification is the first classification. Remember I said I'm just going to introduce this topic, then we are going to continue like that. Probably we are going to have a live session. Yes, maybe next time we're going to meet. So now we want to understand what we call the central acting sympatholytics. What are central acting sympatholytics? The central acting sympatholytics, these are medication. Remember what I told you about decreasing the activity of the sympathetic activity. So we want to use this. We get the medication, this particular medication, which we are going to go central acting sympatholytics. Sympatholytics, we mean to say this particular medication acts against the sympathetic activity. Okay. So what do we mean by central acting sympatholytics? The central, we mean to say central nervous system. The central nervous system we're talking about is the brain and the spinal cord. So when we say central acting sympatholytics, we mean to say the sympatholytics, this medication that works against the sympathetic nervous system, can work in various ways, but the other way is that it also works in the brain, hence central. So how do these sympatholytics works in the brain? Please pay attention to this class and some drugs that are there and what they do and some adverse effects. These are the most commonly asked questions. Where exactly do these drugs act on? What are some of the adverse effects? Just like that. So these drugs reduce sympathetic outflow from the central nervous system by stimulating A2 receptors in the vasomotor center. Vaso means blood vessel, okay? Motor, just like the control center. So this is the area in the spinal cord specifically, because the spinal cord is part of the central nervous system. This is the area in the spinal cord where we have the receptors. Once these receptors are stimulated, they are going to reduce the blood pressure. This is what we mean. So now, once you give this particular medication that like clonidine, methyldopa, moxonidine, this particular medication, they work against the sympathetic nervous system, because sympathetic nervous system increases blood pressure. So once these drugs bind to A2 receptors in the brain stem specifically, because that's where the vasomotor centers are located. So once they bind to A2 receptors, they are going to reduce the blood pressure. This is basically the mechanism of action of this particular medication. So some drugs I've mentioned like clonidine, methyldopa. The methyldopa is commonly used in pregnancy. So methyldopa is commonly used in pregnancy. It's a drug of choice in pregnancy. We have pregnancy-induced hypertension. Okay? Hypertension. So hypertension is going to be induced by pregnancy. So like I mentioned, they are going to stimulate central alpha 2 receptors. What happens? They are going to inhibit sympathetic discharge. Once sympathetic discharge reduces, we are going to reduce the heart rate. And then once heart rate is going to reduce, we are also going to reduce the vasoconstriction. This is going to cause vasodilatation. If the vessels have been dilated, then this is now simple. The blood pressure has been controlled. So the whole mechanism of action of alpha 2 receptors is the central acting alpha 2 receptors is to cause vasodilatation. So important drug that act on that receptor is clonidine. Okay, this is a central acting sympatholytics. Okay, it is used in hypertension as well as resistance hypertension. There is what we call resistance hypertension, whereby a person is not getting well. This is the mechanism of action. Stimulating A2 receptor, these are alpha receptors. Then sympathetic discharge reduces, heart rate reduces, constriction reduces, causing vasodilatation. Okay. So now what are some of the adverse effects? Get this. Because this particular medication acts in the central nervous system. The central nervous system. Now get this. Most of the drugs that act on the central nervous system are going to produce this particular side effect. Even though I'm going to explain why there is dry mouth. Okay. Why there is dry mouth. But everything else here is going to be produced because of these drugs that are acting on the central nervous system. Drugs acting on the central nervous system causes sedation, drowsiness. Okay. These sedation and drowsiness, they are the most common. So now let me explain on the dry mouth. The dry mouth is coming in because what happens is this. You are inhibiting the sympathetic nervous system. Okay. You are inhibiting the sympathetic nervous system. That's where you are going to have some effects like dry mouth. Okay. Then rebound hypertension. This happens because you have immediately, in case of, for example, medication like the clonidine. Okay. When someone has been on treatment and then you suddenly stop, that is going to cause problem. This is called rebound hypertension. It's more like you pull the ring, you push the ring, then you release it immediately. So now, what are some of the facts that you should know about the central acting sympatholytics? We have some drugs like methyldopa. This one is it's used in pregnancy, and some of the adverse effects is that it is sedative, so it causes sedation. Okay, then it can also cause what we call positive Combs test. When we say positive Combs test is that what happens is that this particular medication is very dangerous to the blood vessels. Okay, it's very dangerous to the blood vessels. I mean to the red blood cells. What does it do? It damages the blood, the red blood cells. So if these particular red blood cells have been damaged in the body, they are going to be deemed foreign. So the immune system, specifically the antibodies, are going to bind to this to the red blood cells in readiness for destruction. If they are destroyed, that's when it leads to this hemolytic anemia. But if you have positive Combs test, it's just a warning that the red blood cells have been sized. Okay, so you need to act. So it's important that you take note that positive Combs test, this comes because the red blood cells have been destroyed by this particular medication, and the red blood cells have been marked by the antibodies for destruction. This is a warning, this is an early warning sign. So you need to take action. If you don't take action, they are going to be destroyed, and that's what we call hemolytic anemia. Once the red blood cells have been destroyed, they are going to... So you should take note of that. Hemolytic anemia, once the red blood cells have been severely destroyed, then their capacity of carrying the like transporting oxygen and carbon dioxide, is also going to be reduced. Hence the symptoms that can be produced with. So now we are going to conclude it with this MCQ. These are MCQs, common MCQs on centrally acting sympatholytics. They are going to ask you, maybe amongst the question to say, one of the following is a central acting drug, and the answer in that particular question was clonidine. There were other hypertension medication, okay, like enalapril and everything, but the answer was clonidine because this is the central acting drug. Then it also came to say the A2 agonists, the alpha 2 agonists are probably clonidine. There were other options, of course. So make sure that you understand the class of medication, examples of drug, their specific mechanism of action. The mechanism of action will determine the side effect of the particular drug, just like the pathophysiology of a disease will determine the signs and symptoms. Then you are going to be good to go. So if you have reached up to this far, it means that you've enjoyed this particular tutorial. If you haven't subscribed to this YouTube channel, make sure that you subscribe so that you don't miss any upcoming videos that might be very, very much important. Thank you.